Well, I was there from, hang on, let me think.
2007.
Yes, 2007, 2010, that's right. Those were the Brown years, that's Gordon Brown, which those years had their highs and had their lows. I'm Maryon-Davis. I was president from 2007 to 2010. My first year, really, things were pretty good in the general environment, because the Labour government had put in masses of money into the NHS. It had a huge uplift in funding, and that included public health. So, in a way, public health was sort of riding the crest of a wave at that time. But of course, things changed hugely in 2008 when the global banking crisis, the recession came in. The other thing that happened during my time was in 2009 there was the pandemic, the flu pandemic, swine flu, H1N1 pandemic, which of course took over most of everybody's day and night then, and so all those things were going on. Health advocacy became a big part of my years there, and leading up to the election in 2010, we produced a manifesto aimed at the political parties to try and get them to get key public health messages on the map. The whole nanny state thing was a major problem in my time, because we were giving advice about lifestyles, and a lot of people felt that was very controlling. I got into particular stick when I was saying we need more rules and regulations. I meant by that the tobacco industry, the alcohol industry, the food industry. The government should have a stewardship role around public health. It should be about providing information so people can make their own choices, but also giving them a bit of a steer and creating an environment which nudges them into healthy behaviours without nagging them into healthy behaviours. Just a message for the future, or the present and the future, and that is, I think the faculty is in a key position to advocate and to act as a critical friend or even an enemy of the whole austerity thing and the inequalities that come from that. We are uniquely placed, really, in many ways, to be able to speak out, and I think that strong voice from the faculty is terribly important to maintain. Thank you.